Autism awareness is growing rapidly. Unfortunately, many still hold beliefs about autism that are untrue. This lack of understanding can make it difficult for people to receive the proper support they need. Autism spectrum disorder is a developmental disability that can cause challenges in communication, social skills, behavior, and learning. The term spectrum refers to a wide range of symptoms and severity. While there's no cure for this condition, intensive and early treatment can make a huge difference in people's lives. I'm Dr. Freddy Gomez, and we bring you the knowledge and care you need and deserve. You're watching MedTalk Health Talk only on CNN Philippines. Misconceptions about autism can make people living with this condition feel isolated and lonely. Our guest today will help us understand this condition as well as dispel some of the misconceptions or misinformation surrounding it. With us is Dr. Catherine Baltazar Braganza, who is a neurodevelopmental pediatrician from USC Hospital and the Philippine Children's Medical Center. Also joining us is Ms. Mona Magno Veluz. She is the National President of Autism Society Philippines. Now, let's go through some of the more common misconceptions about autism. I'll start off with that all people with autism have the same skills as well as difficulties or challenges. I'll start with Ms. Mona. What is the truth with that, Ms. Mona?
The truth is, autism, like you said, is a spectrum. In our experience, it is not even just a flat, straight line. It is a sphere. So somebody who may be very, very intelligent may have debilitating anxiety. Somebody who may not be verbal can be such a talented artist. So in fact, even the terms low functioning, high functioning is something that is deceiving because they are so different and so valid. The autism of my son is very different from how the autism manifests in, for example, the clients of Dr. Kat.
But I'd like to go to another misconception, and that is that children with autism are unruly, noisy, very aggressive, very awkward in social situations, maingay. Now, there are those with autism who may shout or hit when distressed, but this isn't the case for all. It's rare for someone with autism to intentionally cause harm to someone else or another person. Ms. Mona, why are some perceived to be as aggressive?
When somebody on the autism spectrum cannot express themselves or they may have other conditions, like sometimes they are unable to sleep at night or they have gut issues, masakit ang tiyan nila, syempre paggising nila, they're going to be agitated. So what we see as aggressive behaviors or sometimes unruly behaviors, especially in the classroom, is not just that. That is a manifestation of other sensory or medical issues that that person on the autism spectrum may have.
Another misconception is that people with autism aren't capable of forming meaningful relationships as well as friendships. They often have very strong bonds with important people in their lives, and they can fulfill relationships with family, friends, partners, and children. Dr. Catherine, this time, please tell us more about this. Yan ang misconception na kapag autistic ang isang tao, hindi siya makaka-form ng relationship.
Maybe the reason why people think of it as that is because they have difficulties with social emotional reciprocity. So they think if a person with autism would be approached, they would have a different way of communicating what they are thinking or their thoughts. That's why they think they couldn't form special relationships. But you are right, they do form special relationships with their loved ones. We feel that as their doctors, and also the teachers could attest to that.
But another common misconception is that people with autism have an intellectual disability. Now, some people with the condition do have this, but others have IQ within the typical range or even higher. Now, we shouldn't restrict their opportunities for education and social interactions by making assumptions about their intellectual abilities. Dr. Catherine, can you expound a little bit on this?
Recent studies would say that only 30% of children with autism would have intellectual disability. So that's a common misconception, maybe because sometimes they do not know how to respond well. So the people would think, oh, maybe they have intellectual disability because it's one of their core deficits. But no, a lot of people with autism would have high IQ. They would just have interest. They would master those interests and do good on it.
People with autism have difficulty expressing their feelings or express them differently, but they're capable of feeling the full spectrum of emotions. Miss Mona, please explain on this concept and why this is so.
They are capable of those feelings, but they express it in a different way. So somebody who is very interested in you and wants to connect with you, for example, may start talking about their interest. They would be obsessed with a TV show and that's all they would talk to you about. It's not about that show that they're expressing. They are expressing their interest in you, and that is their only way that they know how to connect. In terms of the feelings, they also may have difficulty in expressing it in facial expression. Sometimes they also have difficulty in understanding what the facial expression of the person in front of them is talking about. So this is something that we teach, believe it or not, in occupational therapy, in speech therapy. That is a skill that they have to acquire through intervention. But they are capable of so much emotion and so much passion.
Another common misconception or myth about autism is that it is a childhood condition that can be outgrown or cured even. Now, autism characteristics start early in life and continue through adulthood, which is why it can't be outgrown. Could you explain how they should look at this?
Autism is described as a lifelong condition. So the symptoms would change from time to time. So maybe that's why others would think that it could be outgrown. So a study done in 2020 said that around approximately 9% of those children earlier diagnosed with autism don't meet the criteria anymore by youth. So things that were found similar to those children who do not meet the criteria later on would have good cognitive skills by 2 years old and early intervention.
When we return, we'll discuss the symptoms and causes of ASD. We're your connection to healthcare. You're watching MedTalk Health Talk.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao, para sa Mindanao. SMC Davao Cement. Ato ni Bay.
ASD varies widely in symptoms and severity, so making a diagnosis may be challenging. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk. We're together in health. Diagnosing ASD can be challenging, even difficult, as there's no medical test to determine if they have it. Dr. Kath, with that being said, paano na-diagnose, or how does one meet the diagnostic criteria for having autism spectrum disorder?
We base our diagnosis in DSM-5. So the core deficits are usually grouped into two. It could be social deficits in social communication and repetitive, restricted behavior, interests, or activities. The deficits in social communication would include social reciprocity, so nonverbal communicative behavior. So these are the abnormalities in eye contact or use of gestures, and maintaining and understanding relationships. Symptoms for the repetitive restricted behavior, interests, or activities would include stereotype or repetitive motor movements. That's what others would always see, the hand flapping, repetitive jumping or clapping, insistence on sameness or inflexibility to the routines, and hyper or hyposensitivities to sensory input.
Many children don't receive a diagnosis until they're much older. And this delay might cause these children to not get the early help that they need, because the symptoms of ASD will normally appear during childhood, approximately around the toddler age, is around the 1 to 2 years old. What are some of the common signs shown by individuals with autism?
The most common that we see in clinics is language delay. So they don't get to talk on the age that we're expecting them to talk. And usually they come because of poor response to social overtures, meaning when you call them, they don't look at you. They don't turn their head. So red flags that were published include by 12 months, they does not respond to name calling. So that's also the most common symptom that we see. Second is does not point to objects to show interest. So they don't engage in joint attention. They don't tell you if they're happy or they like something. And then by 18 months, they do not pretend play.
What is your advice for parents? When should they see a doctor?
What we suggest to parents who come to us is always trust your gut. If your child, as you see them, as you observe them, is already exhibiting certain things that were not, for something that you did not see in your older child, then you go to a doctor. Also, sometimes when they have cousins, you can compare. You go to a doctor. Also, if you have autism in your family, sometimes your family members can also give you guidance and, okay, that might be a red flag, let's go and check. So our advice is, when in doubt, go to your doctor.
We've been talking about children most of this time, but adults can also have ASD. And this doesn't mean that they develop the condition in adulthood. Most likely, they were unaware that they had this condition or weren't diagnosed when they were children. Ms. Mona, what are the symptoms of ASD in adults?
The reason why people get to a certain age and not be diagnosed, they have a term for it. They call it masking. If your parent tells you you're not supposed to feel that, you're not supposed to do that, then the person tries to adapt. And this happens a lot in girls. They say that girls mask better than boys. We do see a lot of adults on the autism spectrum who have not been diagnosed earlier. In my program called ASP Autism Works, we try to find employment for those who are on the spectrum. And the late diagnosis applicants that we get usually go to their psychologist or their psychiatrist for other concerns. For example, they have difficulty in holding a job or difficulty in expressing themselves to their family or to friends. So these are other issues that bring them to the professionals, and with the professional, they get the diagnosis.
But another common misconception that I'd like to point out, which I think is very important, especially in the Philippines, because maraming naniwala na autism is caused by vaccines. But do we already have an idea on what causes autism?
There is certain predisposition in developing autism. However, we don't know yet what the specific cause is. So regarding the vaccines, I think the reason why people initially believed it was because of vaccines, because the symptoms come out usually at 18 to 24 months when we give the MMR vaccine. So maybe that's why they thought it was caused by the vaccine. So predisposing factors include genetics. So based on twin studies, families who would have one person with autism would have predisposition of having another child with autism. Other predisposing conditions include preterm delivery, high-risk pregnancies. So those are the more common ones that they think of as cause of autism.
With that wide range of people falling into the diagnosis of autism spectrum disorder, how specialized can that treatment be?
So the main focus of the interventions would be to minimize the core deficit, maximize adaptive functions, and minimize the coexisting conditions when they grow up. It should be individualized, so it depends on the needs of every child.
Ms. Mona, let's talk about some of the more common challenges that adults with ASD may have.
What I see as deficits would be inability or lack of tact when they speak. So they are sometimes misunderstood in the workplace. Another one would be their lack of desire to work in a team, and they would rather work alone. They excel in solitary activities. Another thing would be the stress that they receive when you give them deadlines or
Mhm.
when they would have to socialize. Those are factors that for the rest of us that don't really matter, but for them it gives them a high level of anxiety.
What are the basics when it comes to those with ASD? A lot of people may think that they need to have their space around them. They cannot be touched. Are these sort of misconceptions true? Do these still hold true now, or should that vary per individual?
Whenever I have sensitivity trainings and I do this for employers, for example, you have to talk to the individual because they are so unique. Then you have to ask them, how do you want to be called? Do you get offended when I call you autistic? Is it okay for you to be touched? Do you want a little bit more space? Do you need a headset? It's the same for when they are in college and when they are at work. So all of these things matter. And the key thing here is you have to ask them, you have to talk to them, you have to be with them so that you can find out more about individuals on the autism spectrum.
Now, for many people with ASD, living with this condition is not easy. When we return, we'll talk about this and how it affects their families. Your health is our mission. This is MedTalk Health Talk.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao, para sa Mindanao. SMC Davao Cement. Ato ni Bay.
Persons living with ASD often need support from family as well as other people around them. Now, we're here to discuss how you can help people living with ASD. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk, where your healthcare always comes first. Dr. Catherine, what are some of the treatment management options with someone who is diagnosed with ASD?
We usually refer our patients initially for occupational therapy to work on their behavior so that the therapist could help them sit for a long time, pay attention when taught. This would also address their play and their self-help skills. So once they're okay already, we start speech therapy sessions so that they could be taught how to communicate. Also, we always emphasize that family support is very important. People in the house or the family should always support the growth of the child.
Are there tests to see if they can cope up with normal school? Dapat ba special school? Could performance in a normal school be a red flag na baka may autism ang bata?
The choice of school is dependent on the child's needs or the child's abilities. So if we see that they could comprehend, that they could answer questions, or sometimes we do academic testings in the clinic and they could do well in a regular school, then we advise them to be in a regular school. But some kids, they would have difficulties with reading comprehension. Then we suggest putting them or enrolling them in a special school.
Now, Mona, can therapy help someone with ASD function better in society?
They are very helpful in keeping a child engaged in the community. The speech therapy, occupational therapy are very important because these are pre-learning skills. But once they are older, like for now, like there's a pandemic, imagine a child on the spectrum stuck at home who cannot go out, who cannot participate in a community activity. So for the Autism Society Philippines, it has become very important. It has become a priority that we continue our non-traditional intervention by providing opportunities for them to come together on Zoom or on any other platform. It is important for them to flex those skills that they should be flexing if it were face-to-face.
Now, before we go, Dr. Kath, do you have any message for our viewers?
There is always hope in children with autism. When you have a gut feeling that something's wrong, that your child is not developing well, consult at once.
And Mona, any words to say for our viewers when it comes to ASD? And please share with them how they can get in touch with Autism Society Philippines as well.
Autism is a lifelong developmental condition. Those on the autism spectrum can live productive, meaningful lives with early intervention, unconditional love, and societal acceptance. You can go to Autism Society Philippines Facebook page, Twitter, Instagram for details. And let's join hands, cooperate in inspiring acceptance, accommodation, and appreciation for those on the autism spectrum.
This discussion was very helpful, I'm sure, for a lot of our viewers. Thank you, developmental pediatrician Dr. Catherine Baltazar Braganza and ASP National President Ms. Mona Magno Veluz. Research continues to advance our understanding of autism, but there is still a lot more to learn. In the meantime, it's best to seek help as soon as you suspect that there is something off or something wrong. The earlier children with this disorder can get help, the greater their chances of treatment success. Stay safe, everyone. We want to be your partner for a lifetime of good health. I'm Dr. Freddy Gomez, and this has been Med Talk Health Talk on CNN Philippines.